I'm Ann Kurth. I'm president of the New York Academy of Medicine. I'm an epidemiologist and a certified nurse midwife by training, and also the proud mother of a wonderful young man. My father is a retired physician. My mother was a nurse, so there was always this exposure to and understanding of how important healthcare is for people. We were certainly raised with the idea that one should be of service in the world. In fact, my father used to practice in our house, and I used to actually make the pill packs for the patients. So it was a very old school kind of way, but being embedded in the community. And that really was what sparked my understanding of how powerful that kind of career can be. New York Academy of Medicine, since 1847, has been really working to elevate health and use all the tools to do that, science as well as advocacy and research. So the core of what we do is research that's community focused and engaged to advance health for everyone, which is a health equity idea. We're doing that now in the context of also thinking about the issues of our day, like climate change and the impact on human health. We need to be of service and address the issues of our time. One of the principles has really always been about fairness, right? It's one of the big drivers for primates is fairness. And why would some people have such poor health and lack of resources and others, have more access? That just seems so unfair. So being able to sort of take that into account as we try to ensure that everybody has access to the health they need has always been a pull-through. That's been the thread in the fabric of my life, I'd say.
I have known Ann for over 30 years at this point, so we met very early in our career. And I like to say we grew up professionally together. So we came together as HIV/AIDS leaders and clinicians in the early days of that pandemic. And throughout the last 3 decades, we have learned from and supported each other. Ann is probably one of our profession's greatest leaders. Ann has been driven from the very beginning of her career by a commitment to social justice. And that commitment to social justice has shown through in her administrative leadership positions, in her work as a clinician, and her phenomenal success as a research scientist and epidemiologist. Strong emphasis on women and children, health and well-being, and making sure they have voice and agency.
When you meet Ann Kurth, you know that you're with a person who is very, very special. She's thoughtful, she's wise, she's evidence-based, and she also has what we say in Boston, a wicked sense of humor.
It's been my honor to work with Dr. Ann Kurth as the chair of the board of the New York Academy of Medicine. She connects with people. She has that all too often underappreciated ability to work across several dimensions of both academic and political persuasion. And I guess that's, in my mind, that's a real gift that we should all admire.
This honorary degree is a well-deserved recognition of her global leadership and enduring impact.
I hope that people would say that I'm a person who tried to think carefully about the issues of the day, tried to work with people to pull out the best of what we can accomplish to improve life for people. It's very important not to lose hope that change can be made.